Testing my Audible.
Good afternoon. It's 2 o'clock. We're going to go ahead and get started. Thanks for joining us. A quick note for stations wishing to highlight our interpreter. It's Alicia Bronk today. We're going to go ahead and get started. On today's briefing, we have Milwaukee Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services at the Milwaukee County Office of Emergency Management, Marlena Jackson, Interim Commissioner of City of Milwaukee Health Department, and Rick Schlesinger, President of Business Operations for the Milwaukee Brewers. We'll be breaking the briefing up into 2 segments today. We'll first cover off on community testing, then we'll take questions on testing. After that, we'll address Halloween guidance and once again open it up to questions. Mayor Barrett, you're up first.
Thank you very much, Sydney. And there's been a lot of activity, and I'm sure there'll be a lot of questions about the governor's order that just came down within the last hour. There'll be questions clearly about Halloween. There'll be questions, I think, about the National Guard testing plan. But I want to sort of put things in a context because unfortunately, Wisconsin continues to be at the wrong end of the list when it comes to what we're seeing with COVID in the United States of America. In the order that was issued by the governor today, he pointed out that there are only 2 states, California and Texas, that have had more cases in the last couple of weeks than we do. And those states are probably 5 times larger than the state of Wisconsin. And on a per capita basis, we're 3rd behind North Dakota and South Dakota. So clearly there are serious issues here in the state of Wisconsin with the spread of COVID-19. A lot of these surges are occurring not within the city of Milwaukee, not within Milwaukee County, but ultimately could have an impact here in southeastern Wisconsin as well. In fact, if you look at the national charts as to the cities that have had the highest incidence, you're going to see cities like Appleton and Oshkosh and Green Bay really at the top of the list nationally for the you're also going to see the Fox River Valley, the northeast part of the state, the area around Wausau, and the northern parts of the state, western parts of the state have been hit extremely hard the last couple of weeks, which all explains why the governor is taking the action that he's taking today. It also has an impact on us, and it's something that we have been contemplating and we've been working on, is the understanding that the work that we're doing with the National Guard would be temporary in nature. We've had the National Guard here in Milwaukee since early or late spring. And I once again want to thank Governor Evers, thank the National Guard for the incredible partnership that we have had that really, I think, allowed us to do a lot of very, very effective testing here in Milwaukee and the Milwaukee suburbs. So I want to focus my remarks on COVID-19 testing efforts here in the city of Milwaukee, again, to sort of put things in perspective. Yesterday, our numbers were 1,647 at UMOS on the south side. They were 805 at Custer on the north side. Those numbers are both higher than they have been last week. Last week, the numbers started going up, but these are pretty high numbers for those 2 sites. I think, not surprisingly, it's a reflection of the fact that with all the activity that's occurring in the White House, with President Trump, with all his advisors, more and more people are saying, okay, should I get tested? Should I get tested? But what that means is that this week's total is almost 10,000, 9,637 people who have been testing at these sites. But we know now that the National Guard is needed in other parts of the state, that the Wisconsin National Guard is beginning its plans to shift COVID-19 testing staff away from Milwaukee. That is not to say that we are going to be abandoned. In fact, we have been working very closely with the county, and I want to thank County Executive Crowley for his teamwork, Dr. Weston for the work he's done. The county has been a wonderful partner in all of this. And we've also worked closely with the governor, with his staff, with the National Guard to have an orderly transition. And when I say an orderly transition, what I mean is that we want to make sure that we're going to continue the robust testing that we have had in Milwaukee since May. And our goals are to make sure that it's accessible, to make sure that it's in different parts of the city, and to make sure that it's something that people can rely on. So I'm pleased to share with you our plans to create a consolidated, centralized, community testing location at Miller Park beginning October 19th. So a week from next Monday, we will have a centralized drive-through location at Miller Park. And Miller Park brings a lot of advantages to this because of its location, because of the great cooperation with Rick Schlesinger and the Brewers, who have been phenomenal to work with in this as well. But we want to make sure that what we're doing is that we're going to be able to have a site that people can, from around the city and from the surrounding areas, utilize. And we feel very, very confident that we'll be able to do that. So to be sure that everyone is in proximity to testing, we are also going to have two, what I would call regional sites for the city, one on the north side of the city, one on the south side of the city. That means we'll be using the Milwaukee Health Department's Northwest Health Center, which is at 7630 West Mill Road, and the Southside Health Center, which is at 1639 South 23rd Street. Those sites both will be opening next Monday. So that we'll have a week of overlap where you'll be able to get tested at Custer, you'll be able to get tested at UMOS, but you also can go to the Northwest Side Health Center or the Southside Health Center. The UMOS site and the Custer site then will ramp down on Saturday, October 17th. So again, this will be a seamless transition where during the final week that those two sites are open, you'll also have the opportunity to use our Milwaukee Health Department sites. But beginning the Monday after the closeout of the two National Guard sites, you'll be able to go to Miller Park as well. This is going to result in actually more testing capacity, which is something that we think is very, very important. And in fact, the two testing sites in the neighborhoods will complement the Miller Park hub, and I think provide really the overlap that we're looking for to make sure that people in different parts of the city can take advantage of this. So our overall goal for Miller Park is testing site is to maintain the testing capacity we are currently offering at our Custer and UMOS testing sites, which is 2,000 tests per day. At the Northwest Side Center and the South Side Center, we'll be able to do 400 tests at each site a day. So our capacity is actually going to be increasing from 2,000 tests per day to approximately 2,800 tests per day. To be successful in continuing our testing efforts for the fall and winter months, we need to move to Miller Park as our main testing hub. Just logistically, for weather reasons, Custer and UMOS become more difficult, and we cannot appropriately weatherize those sites to protect staff and residents. You will see construction starting tomorrow at Miller Park that will allow us to have a hub at the hub for our workers to be able to do it there. But another important goal for testing has been to continue to provide community testing without barriers. This means that testing will remain free of charge, accessible without an appointment, and available even for those who are currently not displaying COVID-19 symptoms. But we want to put an exclamation point on who we do want to see come, and those are our people who have been exposed to individuals or are symptomatic. Those are the ones that we really want to have tested, and Dr. Weston can go more into that. We also want to remove the barriers to transportation. We've been working with our partners to ensure the Miller Park testing site is accessible by public transportation. That's still a work in progress, and hopefully we'll have some news to report there. Now I think, do I turn it over to Dr. Weston or to the county executive? Again, I want to thank both of them for their partnership. So Cindy, who goes next?
We'll head to County Executive Crowley next.
I thought you were next, but my notes said something different. So let's go to the county executive.
Not a problem. Thank you so much, Mayor Baird, and thank you for your leadership on this. And just to touch on what the mayor has said, Milwaukee County definitely supports efforts to uplift no barrier COVID-19 testing options so that people can continue to get tested. We want to keep county residents safe, especially residents in historically underserved communities, and mitigate the spread of this disease. The Miller Park testing site is a city-led, but also a county-supported partnership. So I want to again thank Mayor Barrett for his partnership in this effort to ensure we continue to provide access to testing. Milwaukee County is grateful to the Wisconsin National Guard for their support and hard work to keep two communities testing sites open and running for the past 5 months. With the National Guard transferring this responsibility of COVID-19 testing to local municipalities, the Milwaukee Health Department is standing up testing sites throughout the city to ensure that residents have access to no barrier testing. And again, we are working to have some options related to transportation. The county is supporting this effort by acting as a fiscal agent for the project, but making sure that we provide support via our core team. The core team is our county's Office of Emergency Management's community-oriented EMS team, which is a group of specially trained paramedics within Milwaukee County. The core team will oversee the medical aspects of the testing site and ensure high quality, safe testing is going on, but making sure that we efficiently move through the testing sites. We appreciate the core team stepping up for this effort because this is extremely an important initiative. And just to continue to talk about racial equity and access, we are committed to supporting testing for the most vulnerable populations. Given the disparate impact that we have seen in Black and Brown communities as it relates to COVID-19, we have a commitment to racial equity, and we are eager to assist the city of Milwaukee in this effort. The county is looking to support additional transportation options to Miller Park in order to ensure that site is accessible by public transportation. Options could include shuttles from surrounding bus stops to the site itself with proper capacity limits, but they have not been formalized yet. The Miller Park site and neighborhood-based sites are open to anyone throughout Milwaukee County. As much as we would like to see no barrier testing sites throughout the region, Milwaukee County, we don't have a health department, and we don't have dedicated funding for testing. However, we're always willing to support municipalities should they request our assistance, as the city of Milwaukee did in this case. The county's Office of Emergency Management has served in this support and coordination capacity since its inception about 5 years ago. And I want to once again thank Mayor Baird and Commissioner Jackson for their partnership on this. And as everyone have probably heard, about a half hour ago, Governor Evers announced another emergency order, basically reducing indoor capacity to 25% with some exceptions. I want to applaud the governor for taking this step to keep Wisconsinites safe. We have not had the opportunity to do a deep dive of the order itself, but we will be looking at the order and adjust any of our local orders accordingly. And with that, I would like to hand it off to Dr. Ben Weston.
All right, thank you, Mr. County Executive. Good afternoon. First, as always, to our numbers, we've had 30,529 confirmed cases of COVID-19 in our community and 435 individuals who died. There's certainly been a lot of thought, work, and resources put into planning this next phase of testing in Milwaukee County as we transition from the National Guard resources at our community testing sites to local assets. A big part of that effort has been determining staffing. In addition to local staffing resources and health department resources, as the county executive outlined, the Milwaukee County Office of Emergency Management is pleased and excited to introduce and implement a new team dedicated to community health engagement. The Office of Emergency Management, or OEM, has for decades worked with local and regional paramedics to supplement their day-to-day jobs with part-time work with the county as special event paramedics. While these special event medics have historically worked at event and gathering venues throughout the county, we obviously saw a pause in those events with COVID. In the interest of keeping those valuable members at OEM engaged, as well as serving the county's goal of advancing the health of all our citizens, we formed the CORE team. So again, CORE stands for Community-Oriented Regional EMS, and the CORE team is a mission-based team that will deploy for community health promotion efforts, starting with COVID testing and potentially in the future expanding to other initiatives such as vaccine administration or CPR training, as well as certainly continuing to support special events at those venue sites. At the community COVID-19 testing sites, the CORE team will help to oversee the medical aspects of the testing process with a specific focus on 3 areas. So first, we want to ensure that the testing process is as safe as possible. We really want to make sure that every person being tested and every worker on that site is safe and protected and not unnecessarily exposed to the virus. Second, we want to promote quality. Continuous quality improvement has been a fundamental principle in our Milwaukee County EMS system for decades, as we work with our 14 partner fire departments to ensure excellent patient care. And this is no different at the testing sites. We want to have every nasal swab performed correctly, every patient informed of the next steps after testing, how to properly isolate and quarantine, and that lab processing and data collection is done accurately to ensure the result can reach the patient in as timely a manner as possible. Third, we want to ensure efficiency of operations and flow at these sites. We know that everyone's time is valuable and want to make sure that you have to wait for as short a time as possible to be tested. So we're excited to introduce the core team in Milwaukee County. We have a great group already assembled, but are continuing to look for more paramedics and EMTs interested in the part-time supplemental position. Certainly any paramedic or EMT, whether you're inside or outside the county, if you're working for a fire department or a private EMS agency or other position, we'd welcome you to apply. And you can find more information on our Milwaukee County Office of Emergency Management Facebook page on those positions and how to get involved. Finally, I want to echo the mayor and once again encourage those with symptoms of COVID-19, those with close contact or who's tested positive, or those referred by public health care tested. And remember, in addition to these community testing sites, we also have in Milwaukee County 16 additional healthcare and community health center testing sites open to the public regardless of insurance, income, or immigration status. And they can be found and accessed by calling 211 or visiting testupmke.com. Thank you very much. Stay safe, and I'll hand it back to Sydney.
Thank you, Dr. Weston. Next up, we have Rick Schlesinger, the President of Business Operations for the Brewers.
Thank you, Sydney. Obviously, we are a small partner in all of this, but always pleased to be able to provide the access that Miller Park does give to our residents for this testing site. It's great to see the local government officials working cooperatively and sensibly to provide testing. As someone who's been tested many times as through the MLB protocols, I can tell you that it is valuable. It is not particularly invasive, and it's really important for people, especially those with symptoms or those who have been exposed to somebody with COVID-19 to get tested. And again, to the extent that Miller Park can offer an accessible, way for people to get tested, we're pleased to be partners here, and again look forward to having people. We've been a little lonely at Miller Park this summer and this fall with no fans, and again, it's nice to have some visitors here, and again doing something that's really important for the county, and that's trying to arrest the pandemic, test and be safe and be smart.
All right, thank you, Rick. We will now open it up for a few questions on testing. Our first question comes from Rich Kirchen. Can Mayor Barrett or the City Health Department comment on the impact of Governor Evers' announcement today, limiting indoor gatherings to no more than 25% of room capacity?
Well, obviously, our local rule allows for restaurants at 50% and then actually up to 100% if it's been approved by our health department, if they've submitted a plan. We've had plans submitted and approved for between 350 and 400 restaurants so far. We have referred the governor's order to the city attorney's office to see how it works. With just a cursory glimpse of his order, I read where it said that local governments could have stricter rules. It did not say anything about different rules that might be interpreted more loosely. But we haven't had a final ruling yet or a final opinion from the city attorney. So we'll let you know as soon as we can. But my suspicion or my guess is that it's going to have an impact here in the city of Milwaukee. And I'll defer to the health commissioner to see if you've heard anything. It's all happening very, very quickly. Commissioner, have you heard anything different, or is that in line with what you're hearing?
Yes, that's correct, Mayor Barrett. We at the health department have not been able to take a deep dive into the order, but absolutely that's what we're doing this afternoon. So I suspect we'll be able to definitely give you all some feedback, but I would say overarching, we anticipate that it will have an impact on our moving Milwaukee forward safely orders. And so we just have to see to what extent and work within the governor's order to best meet the needs of each of the sectors it might impact.
Our next question comes from Caroline Reinwald. A couple of these things were covered early in the briefing, but there have been requests for the dates once again of the switch over at Miller Park. The other
Yep.
questions from Caroline are, why is the community test site moving, or site with the National Guard being moved to Miller Park when COVID numbers are on the rise? Will the National Guard still be involved at the new site? And when does this go into effect?
So let me go through the dates once again. Next Monday, which is the 12th, that's when we will ramp up for the Northwest Side Health Center and for the South Side Health Center. Those are two new sites, and they'll be able to handle up to 400 cases per day. So that's actually an increase in what we've been doing. So the question is, why would we be ramping down? I agree, we shouldn't be ramping down, and we're not. We are ramping up. We're going to have more testing rather than less testing. In addition to those sites, we've got our mobile testing site, which is going to have its capacity increased from 100 tests a day to 300 tests a day. That's a mobile site that can go to residential homes, residential like elderly homes, homeless shelters, neighborhoods. So we're seeing an increase there. So again, the first key date is Monday, October 12th. October 17th, which is a Saturday, will be the last day that the UMO site and the Custer Obama site will be operating. But we're never open on Sunday anyway, so that's not going to have an impact, because Monday morning is when you'll see the Miller Park site opening. Again, there's some logistic reasons here. With the weather getting colder, those two sites are really not as conducive as we would like them to be, both for the people who are working at the sites and for the people who are driving through. As I mentioned earlier, there'll be some construction work beginning tomorrow at Miller Park that will provide us with some guarding against the elements for the workers and for others who need it at the Miller Park site. So again, I want to thank the brewers. They have been phenomenal partners in this. But again, the key dates, October 12th for the beginning of Northwest Side and South Side, October 17th for ramping down of the two National Guard sites, October 19th for the Miller Park site. In terms of the National Guard, it'll be sort of a line down where they're going to basically be helping us train the workers for the first couple of weeks. We anticipate that they will be gone by November 25th. That's what the current plan is right now.
There was one additional piece to that question from Caroline Reinwald. Can anyone, even those who do not live in Milwaukee County, be tested at these locations?
Yes, they can.
The next question comes from Hannah
Right
Jewell.
now, approximately 80% of the
Go ahead.
Approximately 80% of the people who have been tested at the two community sites now have been from the city, but obviously we've had some people from outside the city as well. That stands for the new sites as well.
Thank you. The next question is from Hannah Jewell at Fox 6. Are you hiring workers to take over the testing as the National Guard moves out?
So these testing sites are certainly going to be a group effort. There's going to be core team personnel, as we talked about, providing medical oversight. The Milwaukee Health Department will have some personnel there. And certainly we'll have to hire and work with other personnel as well, whether it's directing parking, helping with registration, keeping the parking lot plowed, everything like that. It's going to be a large effort.
The next question is from Hillary Mintz at WISN 12. Mayor or Rick Schlesinger, what is your reaction to Miller Park and Fiserv Forum no longer being used as early voting sites?
Obviously, we follow the guidelines and the recommendations from the people that spend their time analyzing election laws, and far be it from me to try to get involved in that thicket of complex laws and interpretations. The reality is we are in agreement that for abundance of caution and to avoid any risk that ballots may not be counted, regrettably, we will not be a site for early voting. And again, obviously elections continue, and in the future, if there's opportunities for Miller Park to be a location for early voting, we're certainly open to that and want to do our part to help people safely and efficiently be able to vote.
Thank you. Our next question comes from Patrick Palantonio at WISN 12. What is the expected turnaround time for test results once the National Guard moves out?
So there's no change in expected turnaround time with the transition from the National Guard to more local staffing. There shouldn't be a change in turnaround time there.
Thank you. Our next question is from Mark Stevens at CBS 58. Dr. Weston, did Milwaukee have to find a new lab, or are the community testing sites going to use the National Guard infrastructure?
So I guess branching off the last question, no change in turnaround time because we're using the same lab. We're still going to be working with Exact Sciences. We're still going to be using all the same processes. We've been training side by side with the National Guard for some time now, and we'll be using very similar processing in specimen collection and test processing as well.
And we have one final question related to the governor's announcement. What plans are there? What do you want to say to restaurants who formulated their plans that have been approved by the health department in relation to the governor's order? What is your reaction to the 25% capacity limit by the governor?
Health department that we have throughout this entire process of our orders work very closely with the Restaurant Association, and we'll continue to do that. So we'll continue to keep the lines of communication open as we begin to really look into how this will have an impact. We'll continue to have close communications.
All right, we're going to go ahead and shift gears now. And Commissioner Jackson, if you want to go ahead and cover the Halloween guidelines, that would be great.
Thank you, Sydney. So this year, as we think about Halloween, which is right around the corner, the Milwaukee Health Department wants everyone to know that we want you to have a safe Halloween. We want you to have an enjoyable holiday. But we know that, like most things, this year Halloween is going to look different. We are going to ask that you think creatively about how you celebrate. And we're here today to just provide you with some general information as you consider the things that you can and should not do in regards to celebration of Halloween. So last week we talked about bubbles and how working and living and communicating and socializing in your bubble is a safe way and another layer of mitigation to help slow the spread of COVID-19. So when we think about Halloween and the things that are traditional activities during the Halloween season, we categorize those risks and those activities into low and moderate and high risk activities. So first, I want to share some activities that we know individuals can do either with it as an individual or with their family or within their social bubble that are considered low risk. So first, we suggest having a fun movie night where you can invite your social bubble friends over for popcorn and scary movies is one way to celebrate in a low risk activity. Additionally, having a scavenger hunt in your house or in your neighborhood is another way, in your yard with your bubble is to have another low risk activity. Moderate activities, meaning there's a little bit more risk of contracting and spreading the COVID-19, include activities where there's individually packed goodie bags that are available for grab and go type spaces for children and families to grab goodie bags of treats or so forth. Additionally, having small group outdoor costume parades or costume parties where individuals can space 6 feet apart is an additional way to provide a moderate risk activity, as well as pumpkin patches, orchards, or one-way. Consider it moderate risk as long as they can be outside and you can social distance, as well as provide hand sanitizer or frequent hand washings. High risk activities include going to indoor crowded parties where individuals might or might not be masked. In addition to that, we know that trick-or-treating, the traditional door-to-door trick-or-treating, where individuals are handing out candy to multiple children in multiple spaces, is considered high risk and is therefore not supported by the Milwaukee Health Department, along with indoor gatherings. So no matter how you decide this year to celebrate Halloween, we want to make sure that you do understand that the following things. Number one, that masks or costume masks are not a replacement for actual face cloth coverings in regards to slowing the spread of COVID-19. In addition, we want you to wash your hands and use hand sanitizer frequently. And if at all possible, make sure that your activities are outside and that social distancing is maintained. Thank you.
All right, thank you, Commissioner Jackson. Our next question is from Allison Bruner at Spectrum News 1. As we get closer to winter, what is the plan for warming buses and shelters?
Great question, Allison. We are currently having those conversations right now with our housing division. But as again, when we look at this new order as it relates to buses, we have to figure out what we can do. But we are having those conversations as we speak.
Our next question is for Dr. Weston. The president was given remdesivir as a part of his treatment. It's also being given to patients here in Wisconsin. 1, what do you think about its effectiveness? And 2, should it be more readily available than it is currently?
So I'll start off saying I'm not a critical care physician, and I can't play one here either. But from what I know, remdesivir has some moderate effect on very ill patients and moderately ill patients in helping to make the course of COVID-19 more mild. By no means is it a medication that is going to cure COVID or prevent any of the adverse effects of COVID.
There was one other question. There is a question from Mary Spicuzza at the Journal Sentinel. Just to clarify, is the city of Milwaukee canceling trick or treat or not doing any official trick or treat times this year?
I'm sorry, Sydney, can you repeat the question?
Yes. Just to clarify, is the city of Milwaukee canceling trick or treat or not doing any official trick or treat times this year?
So the City of Milwaukee Health Department does not support any trick or treating door to door, whether it be in any traditional time as we have known it to be in the past, or any individual neighborhood times that we know happen sometimes the day before or the night of. The activity of door to door trick or treating is considered high risk, therefore not safe. And so we do not support that.
So we will not be designating a time as we traditionally do for Sunday afternoon, nor will we be having the support for the neighborhood ones that you see in different parts of the city.
A follow-up question related to this from Caroline Reinwald at WISN. If the health department does not support trick or treat this year, are you going to get law enforcement involved to make sure families do not trick or treat? If not, will the city issue a specific order?
Again, we have not used law enforcement for any of the orders that we've used thus far. We think it's an education issue more than anything else. So I don't anticipate that we're going to have police out there looking for trick-or-treaters. Having said that, we're also not going to create a designated time for trick-or-treating as we've done in the past.
Our next question is from Chuck Quirnbach at Milwaukee Public Radio. Mayor Barrett, is it possible to obtain more financial help for restaurants or other venues affected by today's state order?
Well, it's a very good question, Chuck. Right now, we are in the final 3 days of our Restart 2.0 grant process. And so restaurants that may have been affected, they now still have through close of business on Thursday, October 8th, to submit a grant request, and they can do so by going to the City of Milwaukee website, City of Milwaukee, I think it's Restart, look for the Restart program. And we have up to $10 million that we will be allocating. And so I would strongly urge businesses that are affected to do this and see if you're eligible for some of the funds. And if you've obtained money in the past, you can still obtain money again. Again, that's for City of Milwaukee businesses.
Are there any additional questions for our panelists today? I believe that's it. Thanks everybody for your time today. Oh, we just had one more come in, apologies. Allison Durham, Milwaukee Journal Sentinel. When do you expect to know more about Governor Evers' orders and its impacts?
I can tell you from a city perspective, we're trying to find out as quickly as we can. Marlena?
Yes, that was exactly what I was going to say, Mr. Mayor, is that we are working, it's hot off the presses, and so it's right into our hands for us to evaluate and see how we can then interpret and get the information and guidance out that we need to.
And the same goes for here with Milwaukee County. Our Office of Corporation Counsel is looking at this as we speak.
It looks like we do have one final question related to Halloween. Was there any consideration given to canceling trick or treat this year?
So I can tell you at the health department, along with all of our other decisions that we have made, we spent a significant amount of time. We want to make sure that the information and the guidance that we're giving out is thorough and well thought out, and make sure that we're prioritizing the safety of individuals. So absolutely, there was thought, there was consideration, there was best practice looked at, and again, using our medical and scientific experts as our guidance and our true north of how we make decisions. Yes, we gave it a considerable amount of thought.
Thank you, Commissioner Jackson. I believe that that is all of our questions for today. Thanks everybody for joining us, and we will be back here on Thursday.
Thank you very much.
Thank you.